Today we are going to take a class. We are taking a class on non-communicable diseases. Okay. Now, firstly, just how many of you have had diseases in your childhood? Any disease that you can think of in your childhood, which you had in your childhood, or the relatives had in your childhood? Huh? Fever is not a disease. What about you all? Typhoid. Okay, very good. So you have one is typhoid. Typhoid is an example of a communicable disease. Okay. And non-communicable disease is a very bigger spectrum. Communicable disease can spread by contact, by vectors. Non-communicable disease, on the other hand, the multiple factors for it. So you have two things: communicable and non-communicable disease. So communicable diseases are usually caused by bacteria, virus, parasites, fungal infection, etc. Non-communicable, on the other hand, have got other things. They are also called lifestyle disease. So this is a disease, non-communicable disease cannot be spread from person to person, and it takes a long time. Okay. Also, the person is unaware of the disease until he he gets the infection. He gets the thing, and it's a silent killer of people. Yeah. Okay. So these are the key points regarding non-communicable disease. Next. So examples of communicable disease. One of my friends said typhoid. These are examples of communicable disease. Many of you have heard of these names: influenza, chickenpox, measles, tuberculosis. I just put the common ones: plague, polio, leprosy, malaria, dengue, rabies, and of course we all know corona or COVID. Akash, for it. And earlier days, the communicable disease was a commoner cause of death. When the population was less, we didn't have any protection, and vaccines were not there. Now, with the increasing lifespan, this non-communicable disease are becoming a great killer. Okay, and they are also called lifestyle disease. Now, it's a great cause of death. So, examples of non-communicable disease is this: coronary artery disease is one of the most common ones that you see now. Another one is cancer. Then we have diabetes, hypertension, obesity, stroke, psychiatric illness. So, all these are non-communicable diseases, and some of them are multifactorial, and some of them, if you have some diseases, some things in this, you are prone to other diseases as well. Next. So, non-communicable disease according to age, distribution according to age. In the younger age group, you have accidents and injuries. That's also a non-communicable disease, by the way. Rheumatic heart disease. Diabetes, though we say previously used to say diabetes occurs in older people, it can happen in the younger people also. Then you have psychiatric illness, blindness. In the elderly, as you grow old, these are the things. You have a bigger group of diseases that are coming: hypertension, coronary artery disease, diabetes again, stroke, malignancies, obesity, blindness, psychiatric illness, and others, and respiratory disease. These are the ones that are commoner among the older people. So, this I told you, increased longevity has resulted in non-communicable disease as a major form. You might have seen some of your grandparents, they have suffered from heart attack or stroke or some or diabetes or hypertension, something like that. So, as the age progresses, by the age of 60, 65, that's the time when this non-communicable disease actually come into the mainstream. And now it's a major health problem, as I said, with the lifespan increasing, a big cause of death worldwide, big cause of morbidity also. And 73% deaths are due to non-communicable disease. This is in 2020, with 63% disease burden. Okay. And majority of deaths are due to cardiovascular diseases, cancers, and stroke and malignancies. And many of them can be prevented and focusing on certain key elements like lifestyle, smoking, alcohol abuse, etc., unhealthy diets, lack of physical exercise. These are the general risk factors for most of the non-communicable disease. Tobacco use, alcohol use, sedentary lifestyle, raised blood pressure, obesity, diabetes, hypercholesterolemia. So, now here in non-communicable, we have two things. One is risk factors, modifiable risk factors, non-modifiable risk factors. Some things you cannot modify. Your genetics, for example. What if your parents have got some risk factors? A part of it may or may not come to you. So, again, age is something you cannot change. Sex, family history, genetic factors and personality. Modifiable are cigarette smoking, alcohol, dyslipidemia. Dyslipidemia means increase in the levels of lipids like cholesterol, sedentary lifestyle, stress, environmental factors, and inability to avail of preventive health care services. So these are all the important things that the modifiable risk factors. Non-modifiable, you can't do anything about it. Modifiable, only you can change. This we have talked about it again. For it. Okay. So here again, what we can change, we can't change age, sex, level of education, genetic composition. What we can change is the behavioral risk factors like tobacco and alcohol use, unhealthy diet, physical activity. Intermediate risk factors also like elevated blood lipids, diabetes, high blood pressure, and obesity can be controlled. So the first one we can't do anything about, but second and third we can do something about it. So this is how it looks like. Behavioral risk factors: tobacco, alcohol, physical inactivity, nutrition. Then the physiological risk factors: body mass index, blood pressure. Have you studied? You know what is body mass index? No. Yes or no? You know what is BMI? Okay. Then blood glucose, cholesterol. Disease outcomes are heart disease, stroke, cancer, diabetes, etc. Right. So this is how the natural history of NCDs come. You have abundance of food which leads to obesity, hyperlipidemia, atherosclerosis, then you land up with coronary artery occlusion, and then it becomes, you land up with heart attack, or thrombotic tendency, again lack of physical activity, smoking, stress, emotional disturbance, aging, all this lead to hypertension. And finally what happens is most of them land up in some problem with the blood vessels, and you land up with a heart attack or a stroke or something like that. So obesity, let's go to the first one, which is the simplest one, which is obesity. So this is an excessive fat which represents a risk to health. It's the most common form of malnutrition. Now why do we say malnutrition? When we think of malnutrition, we all think that a person was hungry, famished, lived in somewhere like Africa and all. That is the concept of malnutrition. But no, obesity is also a different type of malnutrition. And here what happens is this central fat distribution of android obesity is that which is more common than gynoid, so-called gynoid fat distribution. So now obesity is, we are a contributing factor to obesity. When in childhood, always we like to see a chubby child. But once the child grows up, the child should be given a chance to play. Nowadays, who's playing? The child is playing on the mobile phone. Child knows he watches videos on the mobile phone. During our time, we had playgrounds, you would go to play. Now, there's hardly anybody goes to play. And what is happening is, those days we had TV, we had to go to the TV to change the channel. Now you don't need that, you have a remote. You have a phone for everything. If you want to order food, you use a phone. So that we are becoming a sedentary lifestyle. Then junk food and more screen time. These are the common factors which are there in obesity. So again, this is a global problem, and it's a second leading cause of preventable death according in the globe, surpassed only by smoking. So this is, this formula BMI, body mass index, that is weight in kilograms by height in meters squared. So if it's more than 20-25, it's considered as overweight. If it's more than 30, it's considered as class 1 obesity. More than 35, it's class 2 obesity or severely obese. So we should try to keep the BMI between 8.5 to 20, between 18.5 to 25. Then only we are considered as normal beings. So again, we have talked about this: physical inactivity, diet, drugs. Drugs also can cause obesity, medical conditions, and genetics. Then comes the next one, hypertension. Now when we say hypertension, we always think that, what is hypertension? Hypertension basically means an increase in blood pressure. So often we say that this person is hypertensive. Hypertension by definition means the increase in blood pressure above the normal range. So this is what happens is increased blood pressure causes the force of the blood pushing into the walls of arteries. So that can cause problems. So now earlier it was 120 systolic and 80 diastolic. Now the American Heart Association and various other organizations, they've changed it to 130. 130, 80 is considered as normal. Anything above that is considered abnormal. But as the age grows up, as the age goes, you can have certain extension. But this is a normal range, 130 by 80. So again, this is again a major problem in the world, and they're saying that 1 in 3 adults in the world will have hypertension by 2025, which means that I must be having hypertension. You also must be having hypertension, some of us. And we are unaware of it. Until somebody comes and measures our BP, we won't know what is happening. And also elderly people, as the elderly population increases, the chance of hypertension is much more. So again, hypertension, if you look at it, you have two classifications. One is primary and secondary. Primary is without a source. We don't know what is the cause of the hypertension. And secondary is if there's some other illness which has caused the hypertension, like for example, endocrine disorder or kidney disease, which has caused the particular hypertension. So the primary one is the most common cause. We don't know what is the cause of hypertension. His pressure is 180 by 100. What is the cause? Nobody knows. Otherwise, everything else is normal. Then it's called primary hypertension. Secondary hypertension, on the other hand, it's considered with some kidney disease or something like that. So again, here again, a lot of risk factors. Some are genetic, some are non-modifiable, some are modifiable. So among those, what we have is family history. If you have family history, the chances that there may be a chance of hypertension for you. Then genetics again, inactivity, stress. Now when we talk about stress, what we mean the job stress, the other environmental stress. Your environmental stress means your social environment. There may be a problem in your family, a problem in your workplace, problem in your college, problem somewhere else. That is adding to your stress. Then alcohol, high sodium diet, and also the age. As the age grows up, increases, your blood pressure increases. So, what are the complications of hypertension? Firstly, it can cause vision loss, hypertensive retinopathy. It can cause a stroke. It can cause a heart attack, or it can cause kidney damage. These are the basic things which hypertension can cause. Okay. So, this is a hypertensive retinopathy. The blood vessels in the eye, they literally burst. So, suddenly the person, he's not aware of his hypertension. I mean, it happened to one of my friends, one of my close friends, my classmates. He didn't know what is happening. Suddenly, he couldn't see with one eye. Even now, he can't see fully. And then it was found that he's had this hypertensive retinopathy. He never knew that he had high blood pressure till then. And only then did he know this was there. So again, we are modifiable factors: body weight, sodium chloride intake, alcohol intake, physical inactivity. Psychosocial factors, that again is not fully modifiable. Socioeconomic status, hormonal contraceptives. These are all risk factors which you can modify. Non-modifiable are same things. We can't do anything about that. Age, sex, gender, hereditary, ethnicity. We cannot do anything. This side, left side, only we can do something to modify it for it. So these are the factors. Age, as the age increases, blood pressure increases, and again among the sex, later, initially there was no difference, but later on men have more stress, and then they have a higher hypertension. Genetic factors again, they play a major role in this, and certain communities, like for example, the black communities in USA, they have high blood pressure. These are all ethnic variations. And again, obesity, what we talked about the previous one, obesity also can lead to hypertension and salt intake. Now, people who consume more salt, they are more prone to get hypertension. So, there is evidence that 7 to 8 grams of salt extra can cause hypertension. And saturated fat, that apart from causing high levels of cholesterol, that itself is a risk factor for hypertension. So, you have obesity, salt intake, as well as saturated fat. Environmental stress, as I told you, maybe a job stress, somebody is in a sales job, he's got to complete a certain target, so much sales, then only he'll get promotion. That is stress. You have some something in your family which is causing stress, somebody is very sick or something like that, that causes stress. Then socioeconomic status. So now, previously it was thought that high blood pressure occurs only in people with a higher standard of living and high socioeconomic, who are well off. But now it occurs even in low socioeconomic groups, particularly when people are striving to get themselves into the higher bracket. Okay, so this here now comes to the prevention of hypertension. You have a primary prevention as well as a secondary prevention. Primary prevention again consists of two parts. One is population strategy and the other one is high risk strategy. Population strategy means you are looking at the entire population. How can you look after the entire population? And a specific strategy or high risk strategy is the people who are at risk, the important people, the people who have a history of hypertension. We are going to look at them only for it. So, primary prevention is directed at the whole population, irrespective of whether they're at risk. Say if you want to do, say hypertension of this area of our college, you just stop the salt intake in the college for maybe 1 month or so, see the difference. I'm just giving an example, but it may not be possible always. But then any small reduction would produce a large reduction in the increase of cardiovascular complications. So if you can do something like that, but general population strategy is not the answer for hypertension as such, because you can't do something for the entire population. You cannot ban salt or some salt intake or something like that. Then, but these are things which can be done. Reduction of salt intake to less than 5 grams per day, moderate fat intake, avoidance of high alcohol diet, and restriction of energy intake appropriate to body needs. And again, weight reduction, that is also a factor which can be done for prevention for primary prevention. Then exercise promotion, behavioral changes and health education. So we all know this, exercise promotion helps a lot. We go for walks. You don't have to go to the gym or swimming or cycling. Just go for a brisk walking for half an hour. That will take care of a lot of all these problems. Then behavioral changes like lifestyle, yoga, meditation could be profitable. And health education, people should be aware of the health risks. Okay, next. Now, high risk strategies for those people or those who with a family history of hypertension, somebody's parents are hypertensive or is likely to have. So here this is a high risk, you just detection of high risk subjects, and there's something called clustering that you'll learn in your later classes, and tracking. Somebody's got high blood pressure at a young age, he or she is likely to have a higher blood pressure in the old age. So if you catch a student somebody who's maybe 18 years and his blood pressure is 140, that person is likely to develop high blood pressure much later. So that is a high risk strategy. Detection of high risk subjects should be encouraged by the optimum use of clinical methods. Because hypertension tends to cluster in families, in family history of hypertension, and tracking of blood pressure from childhood could be early helpful to identify individuals at risk for it. Next is cardiovascular disease. Now again, when we talk about cardiovascular, it's a very broad spectrum thing for it. So this is any disease which involves the heart or the vessels, and technically, or we say heart attack, that's a general term. As we say myocardial, that's a more technical term, myocardial infarction. But for us, we say cardiovascular disease in which there is atherosclerosis involved for it. So again, these are the different types of cardiovascular disease. Again, it can present many forms. Hypertension itself is a form. If somebody asks you, what is the problem? They say, "Amar pressure ache." You will not say, "Amar pressure ache." That's the thing. That hypertension is one thing. He won't say coronary heart disease. He will say heart problem ache. But then cerebral vascular disease, that's stroke. Then you also have peripheral vascular disease, heart failure, rheumatic heart disease, congenital heart disease, and cardiomyopathy. So this presents in various forms, but the more important forms as far as we are concerned is hypertension, coronary heart disease, cerebral vascular disease, peripheral vascular disease, heart failure. Rheumatic fever, rheumatic heart disease and congenital heart disease are usually occur in the young age group for it. Okay, so this is a global, we all know, this is a global cause of death. and number of millions die from cardiovascular sudden deaths, or people who are on treatment, they die for it. And they also died, not only cardiovascular deaths, they also died due to stroke. Stroke is a further step after cardiovascular deaths. And many of them, deaths occur in low and middle income countries. And many countries, they either have people dying of cardiovascular disease or stroke. So this is a breakdown of people deaths from cardiovascular disease. The majority, if you can see here, are from deaths from cardiovascular disease. 30% deaths are due to cardiovascular diseases, and cancer contributes to 27%. So cardiovascular, cerebrovascular disease is the most important among all the diseases that are in the non-communicable diseases. Okay. So again, the risk factors, modifiable risk factors, we can't modifiable sex, age, sex, genetic history, and family history. The ones which you can modify, again, cigarette smoking, high BP, blood cholesterol, diabetes, obesity, and sedentary habits. These are all, and stress. These are the ones which we can again modify for it. So again, here you have a high risk strategy as well as a prevention in the high risk groups as well as the general population for it. So basically, cardiovascular disease is a mass disease, so you can't. It should be focused on mass approach. So it should basically focus on the control of the risk factors like alcohol abuse, cigarette smoking, lack of activity, and so on for it. So high risk strategy is you identifying the risk and then you're giving advice. For example, if you find somebody who's taking alcohol regularly, or somebody who's a heavy smoker, then you can bring them under preventive care, motivate them to take positive action against all the identified factors. Similarly, if the person has got high BP, increased cholesterol, and family history, then again you treat the blood pressure, give them medicines for other things also. Okay, and for people, you can wean people from smoking using the nicotine gum. So again, specific interventions, dietary changes, smoking, blood pressure, and physical activity. So if dietary changes, limited consumption of fatty acids, reduction in dietary cholesterol. Then this smoking, you stop smoking and no smoke-free cigarettes. And then again, prudent diet, reduce salt intake, avoidance of high fats, and regular physical activity, and encourage children to continue throughout to exercise. Okay, so these are things which are there in your specific interventions for it. So primordial prevention. Primordial prevention means before the risk factor itself has occurred, you start trying to prevent. Like for example, before the onset of cholesterol or hypertension, you encourage. How can that be done? For example, a child, he's taught to exercise, he's taught to play games, and he's taught to take part in other activities. That is the way of primordial prevention for it. So again, high risk strategy only when we for it. Okay, so secondary prevention again, that is after disease has occurred, you have cessation of smoking, control hypertension, nutrition, and exercise promotion. These are the ways in which you can control the secondary prevention for cardiovascular disease for it. Then this is one important thing, which is diabetes. Again, very common, extremely common for it. Now, diabetes actually is something that can cause everything. During our times, the examiner would ask us, what other disease can cause this? What other disease can cause this? So finally, if you don't know the answer, you just give diabetes. So the popular joke was that time was, diabetes can cause everything except pregnancy. Okay. So the diabetes affects a lot of organs, and it's a killer, silent killer for it. So you have type 1 diabetes and type 2 diabetes. Okay. Type 1 occurs in childhood, and it's affected hereditary and insulin group. They can't do without insulin, and they need daily insulin to survive. Type 1. Type 2 on the other hand occurs in adulthood. You can start with oral hypoglycemics, oral tablets. You don't need insulin for it. Okay. But type 2 is the more common one. That is people who are therein for people who for adults. And again, here again, obesity is a factor. So obesity is a factor in cardiovascular disease, it's a factor in hypertension, it's a factor in diabetes also. Then you also have gestational diabetes, which is diabetes occurring in pregnancy. When usually during pregnancy, the blood pressure, the sugar levels raise a bit. After pregnancy, they should come down, but sometimes they don't come down. So during pregnancy, we have a condition called gestational diabetes, in which during the pressure, the blood levels are increased, and as a result of the gestational diabetes, the baby is born overweight, and again there is a high risk of type 2 diabetes in cholesterol and cerebral vascular disease. So this is a complication of diabetes. It affects all the organs. It affects the brain. You have cerebral vascular accidents, cognitive impairment. It affects the heart. It can cause coronary syndrome, myocardial infarction, congestive heart failure. It can affect the legs, extremities. You have gangrene. You have the fingers or toes amputated. You have ulcerations. Then nerves. You have tingling sensation in nerves. You have what we call diabetic neuropathy. Then kidney. You have nephropathy. That is, kidneys are affected. That is a very dangerous thing. The patient will may land up going to dialysis. So you have microalbuminuria, gross albuminuria, and kidney failure. I think you might have studied in your biochemistry or class about albuminuria. And eye, again, retinopathy, cataracts, glaucoma. So diabetes is something which is a big spectrum of diseases. So this is macrovascular and this is microvascular. So if you don't control your diabetes, you are in for big trouble for a time. So major complications are wound ulcer. You might have seen this, leads to amputation, damaged blood vessels in retina, which can cause blindness, kidney failure, stroke, heart disease. So all these are factors which are there in diabetes. So diabetes, as I told you, it's a very major problem. So here again, risk factors, obesity is once again a risk factor, family history is a risk factor, history of gestational diabetes, high cholesterol, though it's separate, that is also, a person with high cholesterol is likely to have diabetes also, and hypertension. So diabetes has got multiple risk factors, some of them overlapping with cardiovascular disease and your hypertension for it. So these are the genetic factors. In type 1 diabetes, usually is a family history, and there is an event such as virus or toxin which triggers autoimmune destruction of beta cells, okay, over a period of several years. This is the usual cause for type 1 diabetes. Type 2, we have other risk factors, family history, obesity, habitual physical impaired glucose tolerance, hypertension, hyperlipidemia, and previously identifiable glucose intolerance. So all these are risk factors for developing diabetes in type 2 diabetes. So here, how do you prevent it? Lifestyle changes can prevent diabetes to a large extent. Physical activity that decreases the insulin resistance, and decreased intake of saturated fat, and decreased intake of fat can lead to, and decreased intake of fiber can lead to lower insulin sensitivity. So you have to take plenty of fiber. Fiber means a lot of green vegetables and stuff like that. Okay. So in general, reduction in overall calories, reduced intake of saturated fat, and increased intake of grains, fruits, and vegetables would be useful in preventing diabetes. So lifestyle changes can prevent diabetes to a large extent. Physical activity and dietary changes for it. Secondary prevention, again by early diagnosis and treatment. So this can be done by population screening and selective random screening by taking the high risk groups only. So like those with strong family history, with obese persons, more than 40 years, people over 40 years, women giving history of diabetes mellitus, gestational diabetes, those with a history of impaired glucose tolerance or something like that, or with hypertension. And this again also reduces the complications of diabetes. If you can do secondary prevention. So diet, discipline, and drugs. These are the three things which are there for diabetes. Okay. So diet, discipline means exercise, lifestyle. drugs, medication, either oral hypoglycemics or insulin. Now, this is the most important thing, cancer. Now, we all know cancer is one of the most important non-communicable disease, and unfortunately, it is one of the most dangerous, most debilitating diseases. However, the plus point is that if it is detected early, that person can survive for a long time. Okay. So, this is the statistics of the cancer. So many people die of cancer, causes 13% of all deaths. And maybe 20 years back, 15 years back, at least in my circle, there was nobody suffering from cancer. But now, my circle, my immediate family, we have people who died of cancer, people who have survived of cancers, etc. They've undergone chemotherapy, radiotherapy, etc., etc. Alright. So the common cancers are lung, breast, colorectal, stomach, and liver cancers. And in higher income countries, you have the lung cancer is common among men, breast cancer among women, and different countries have different factors. Now they say breast cancer is the best cancer because if detected early, that is the one that has the maximum chance of survival. Other cancers, lung cancer, for example, the chance of survival is very poor even if detected on time. So what are the causes of cancer? Again, hereditary, immunity, clinical, physical, viral, bacterial, lifestyle. So hereditary, some countries, some nations, some people have a particular predisposition to some cancer. For example, colorectal cancers are very common in North America, that's USA, Canada, Australia, and New Zealand. USA, in fact, every year over the age of 40, you're supposed to undergo, if you must have health insurance, and as part of the insurance, they actually do a colonoscopy to check whether you have colorectal cancer. Okay. Stomach cancer, again, Korea, Japan, and China, it's due to their diet probably. Liver cancer, West and Central Africa. Prostate cancer, Europe, North America, and Oceania. Next. So, immunity, again, you all have heard of HIV. People who have HIV are prone to cancer, particularly something called Kaposi sarcoma, and those who are immunosuppressed, they are already taking treatment for something, they are also prone to cancers. Again, some viruses cause cancer. You have this hepatitis B virus can cause cancer, human T-cell leukemia virus, Epstein-Barr virus, and human papilloma virus, which causes cervical cancer. These are all things which are caused by viruses. Bacterial, you have H. pylori can cause stomach cancer, and also some other parasites like schistosomiasis, chlorhomoniasis, which can cause cancer of the bladder. And chemicals. Now, this is a thing which has come in recent times. Chemicals have been proven and suggested as a common cause of cancers. You have also, among that, you have alcohol is one thing, asbestos, wood dust, rubber, plastics, tar, bitumen, aflatoxin, alkylating agents, and tobacco. These are all the environmental things which can cause cancer in a big way. And many more are being attributed. Some say this chemical, that chemical, but these are the ones which are generally considered problems. Lifestyle, again smoking plays a major role. It's common among, particularly it causes lung cancer, but not only lung cancer, it causes other cancers also. And was known to cause cancer as early as 1950, but still people are continuing to smoke. Of course, though there are many restrictions going on for it. Then this is these are ways of preventing cancer. Avoid obesity, do not smoke, do some physical activity. Then again, increase your dietary intake of vegetables and fruits, and at least 5 servings a day. Limit your intakes from animal sources, and avoid exposure to radiation and harmful chemicals. Nowadays, they say even this mobile phone is having some radiation. Some studies have said, but it's not conclusively proved. Okay. Then again, at least 1/3 of the new cases can be prevented if the reducing tobacco and alcohol use and moderating and immunizing against hepatitis B virus. Again, early detection treatment, as I told you, for breast cancers, many cancers can be cured. It's not that cancer is the end of life. You can be cured if detected early. And there are various techniques nowadays available to detect cancers for it. So these are the common screening tests for cancer. Breast cancer, self-examination in breast. So all the lady has to do is just examine herself in front of the mirror or in the washroom or whatever. She'll know if there's a lump. Then mammography is there. That is expensive. Then after that is fine needle aspiration cytology, FNAC, of the breast lump. Carcinoma cervix, another one. Again, which is quite common. You have what we call a pap smear. That is a specialized thing. And you have also VIA, vaginal inspection by acetic acid. That's a low-cost method. The change of the color of the acetic acid gives you an idea whether this person is having cancer or not. Then prostate cancer, you have prostate-specific antigen or PSA. Lung cancer, chest X-ray, colon cancer, colonoscopy. So these are common screening tests for cancer. Okay. So the WHO's approach has four pillars, basically: prevention, screening, early detection, treatment, and palliative care. Palliative care means you know there's nothing more to be done. The patient has got multiple metastasis. Nothing can be done more. So just give support. Okay, just give him peace. Don't try some fancy thing, because you know there's the disease spread to the lungs, spread to the bones, etc., etc. Just give him supportive treatment. That is called palliative treatment. Okay. So, and also palliative care means preparing the family for the eventual thing. That there's nothing more to be done. What you have done, you could do. Nothing more to be done for it. So again, these are non-communicable disease parameters for estimation of behavioral and metabolic risk factors. Current tobacco smoking, the percentage of people who above 15 or older smoke daily on a daily basis. Physical inactivity, percentage of people above 15 who are engaged in less than 30 minutes of activity. Many people don't do activity for 30 minutes, just asking for just a week, or less than 20 minutes of vigorous activity daily. So this is a major risk factor. And raised blood pressure. These are all the various things for parameters for non-communicable disease, for controlling, for estimating behavioral risk factors for it. Then raised blood glucose, overweight, obesity, and raised cholesterol. These are again parameters. The percentage of people 25 years old or more who have a fasting blood sugar more than 100 milligrams or on medication for raised blood glucose. Then overweight, people who are having more than a BMI of more than 25 kg. Obesity again, population over 30. Okay, so over 25 is overweight, over 30 is obese. And raised cholesterol, people having more than 190 cholesterol, that is considered as having high cholesterol. Right. So how can you prevent NCDs? Broadly, they can be prevented by stronger implementation of measures, including government policies like, for example, stopping smoking or things like that. Then promoting healthier diets, physical activity, reducing harmful alcohol use, and also improving access to people's health care. So that's all for today. Okay, thank you very much.